We got to play this Bill Cassidy clip. These people on the right, this is a U.S. senator, have no idea the level of just like the depth, how deeply embedded their racist ideas are. And I mean, to the point where they just no clue. We saw this. Remember all the maps? If black people didn't vote in the United States, Donald Trump got millions of more votes.
If my aunt had balls, she'd be my uncle.
Right. Right. Except for in this instance, correct. In this instance, it's like it is just explicitly saying we only really count white people.
Yeah.
And that we add in black people into the country just as like a thing. You know, it's like an add-on. But the country is really white. And then we add on these other things. Listen to this. He's talking about he is talking to, it's a conversation sponsored by Harvard School of Public Health. I mean, how twisted is this? He's being interviewed by a political reporter, Sarah Obermale?
Yeah, Obermale, I think.
Obermale. And they ask about Louisiana's maternal mortality rate. Listen to what he says.
Be different in the future.
Last question on this topic before I move to the pandemic, but because you raised maternal care and the importance of, caring for a mother throughout pregnancy and childbirth, I know that Louisiana ranks very low or I should say very high on maternal deaths amongst the states. So what do you think needs to be done there to improve that, especially if forms of abortion or birth control could be limited in the future?
I'm not sure people are talking about limiting forms of birth control.
Pause it for 1 second. Pause it for 1 second. Yeah, people are. Incidentally, people are. And in fact, I think Louisiana was the state where they came out of committee the idea that that we're going to start this at fertilization, not at conception, and i.e., as soon as the egg fertilizes, the sperm fertilizes the egg, as opposed to that fertilized egg being embedded in the wall of the uterus. So you're talking about IUDs there.
Yep.
In addition to maybe some, some forms of like chemical contraception. But at the very least, you're talking about contraception. But you know what? I'm going to cut him some slack because that took place in Louisiana, and he's the senator from Louisiana. Go back a little bit.
Or birth control could be limited in the future.
I'm not sure people are talking about limiting forms of birth control. And shall we say, if you're using abortion to limit maternal death, that's kind of an odd way to approach the problem. But anyway, that said,
what?
Louisiana, about a third of our population is African American. African Americans have a higher incidence of maternal mortality. So if you correct our population for race, we're not as much of an outlier as it would otherwise appear. Now, I say that not to minimize the issue, but to focus the issue as to where it would be. For whatever reason, people of color have a higher incidence of maternal mortality. Now, to be sure, there's different definitions of maternal mortality. Sometimes maternal mortality includes up to a year after birth and would include someone being killed by her boyfriend. So in my mind, it's better to restrict your definition to that which is perinatal, if you will. The time just before and in the subsequent period after she is delivered. Now, there's different things we can do about that. I have something called the Connected Moms Act.
I don't even want to hear what he says after that. Let's be clear on a number of things here. He's saying we can ignore the fact that we have higher rates of mortality because statistically speaking, we have more black people here.
He says correct the population.
And then the idea like, some of these numbers could be distorted because their boyfriend kills them.
For whatever reason is the real genius part of naturalizing this.
Exactly.
Because the reason is that we treat black people worse in this country. Like that's why it's all the structural problems that have basically come from the like economic engine of slavery in this country.
Racism.
Yeah, literally
Racism.
But he perceives black people as like a pesky drag down of their numbers.
Yeah, just
and
genetically inferior, so they have
Exactly.
some natural immune thing.
so those two premises work in tandem.
And this guy's trying to pretend like I don't know what abortion would have to do with maternal mortality. Excuse me? Hey, have you not been
Happens all the
familiar
time.
with life? With the life of the mother or health of the mother is jeopardized. I mean, it's just
happens all the time.
It is so disgusting. It is so disgusting. The guy sort of like leaning on racism as a way of talking about the failures of. I mean, imagine if he considered those people his constituents, and he doesn't. But imagine if he considered those people his constituents and still had to. Well, if it wasn't for a third of the people who voted for me, we'd be in much better shape in terms of that statistic. I mean, just like it's so disgusting.
Or maybe he's less inclined because maybe the black population is less likely to vote for Bill Cassidy.
Oh, well, I think that's not a coincidence, but I think it's definitely true. I think he definitely is like.
Do you know what Bill Cassidy's background is professionally?
I was just going to ask.
Just guess. Wild guess.
OBGYN.
Well, close.
He is a medical doctor, though.
Yeah.
Cassidy specialized in the treatment of diseases of the liver at Earl K. Long Medical Center. In 1998, Cassidy helped found the Greater Baton Rouge Community Clinic to provide uninsured residents of the Greater Baton Rouge area with access to free health care. The clinic provides low-income families with free dental, medical, mental health, and vision care through virtual approach that partners needy patients, blah, 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 blah.
The entire like anti-CRT stuff is so that medical schools can continue pumping out more guys like Bill Cassidy.
Yeah.
Yep. Do you, in his practice and in the doctors that he hired, do you think that there were times where there were racist views about medicine directed at black patients that went into his low-income Greater Baton Rouge Community Clinic for healthcare?
I would bet everything I own that the answer of the incidence of that type of racism there isn't far greater than zero.
And would that probably have an effect on the outcomes, including mortality rates for black mothers?
I mean, we know statistically speaking that when black people, particularly black women, go in and talk about pain or these problems, that they're completely ignored. I mean, completely ignored is wrong. The rate in which they are listened to is far, far lower.
Yes.
But this is just, I honestly, I can't get over it. It really just, I don't know. Maybe it's the suit. Maybe it's just, him sitting in this chair or, talking to the Harvard school. Well, it's someone from Politico. She should have followed up, incidentally, on about 3 of those different things. It really is amazing. But there it is, folks. There it is. I mean, also, now contemplate this too. If he's sitting there and pretends that he doesn't know what life of the mother has to do with abortion, and also you don't have to pretend like he clearly thinks that like we can separate the cohort of black people who die in this instance. And then really just look at the numbers and know that we're doing a pretty good job. It's just the problem is that the black people we're not servicing them at all. Because what are you going to do? I have no idea why that maternal mortality rate is higher. But like, when you look at abortion, and Natalie Scher made this point in Boston, this is a class issue in many respects, because you're talking about people who, women who make $18,000 or less, and they will account for 50% of the abortions. His ability to sort of both like, segregate and segment certain people from other people in the way that he just did there when he's talking about more maternal mortality, gives you a sense of like, we can outlaw abortion because we're not really outlawing abortion for the wealthy people. And you know, like, I don't know if he's one of those religious zealots, because I think a lot of them want to outlaw abortion for everybody and put everybody under the eye, as it were. But for people like this, he can just say, like, you know what, we're not, I mean, we're outlawing abortion,
Yes.
but not really outlawing abortion. If you put aside the people who make under $18,000, if you put aside, you know, if you put aside the African-American, the black population in here, we're not really outlawing abortion.
So I just was trying to find this one statistic, and this is from 2016, but there was a study done where researchers at the University of Virginia quizzed white medical students and residents to see how many believed inaccurate and at times fantastical differences about the two races. For example, that blacks have less sensitive nerve endings than whites, or that black people's blood coagulates more quickly. They found that fully half thought at least one of the false statements presented was possibly, probably, or definitely true. Moreover, those who held false beliefs often rated black patients' pain as lower than that of white patients and made less appropriate recommendations about how they should be treated. So, like, this is one that's just like a function of the fact that we live in a systemically racist country. But two, there's going to be more Bill Cassidys. There are more Bill Cassidy type doctors out there than people want to think about.
It just reminds me of the last year or so after Hurricane Ida, there was a bunch of power outages, and about like 14 or 15 people died basically because the heat was so bad. There's this one guy from this New York Times article. In the days after Hurricane Ida, his home began to feel like a trap. The huge power failure that cut off electricity to New Orleans rendered Mr. Joseph's air conditioner useless and his refrigerator nothing more than a cupboard. Even worse, the outage froze the complex's elevators in place, sealing him inside his building because his health problems prevented him from using the stairs. He was 73 years old, and he had conversations with his kids, and he eventually died because after like 10 days of not getting power to folks. And who do we think it wasn't because of his genetics, it was because he's a black in New Orleans, and like people are kept in poverty in these awful and not cared about, whether it's maternal health care or power like this.
I mean, let's also remember, the we also know that if you just look at even the statistics in New York, for that matter, black and brown people died at a higher rate during COVID, and because you had far less quality hospitals in their communities to deal with people, and then head to Texas, where basically they're promoting, and the whole conservative movement was promoting this idea. We can sacrifice some people so that we're not inconvenienced.
Well, once we figure out which people those are.
And no doubt there was a sense of people who are either most vulnerable. And look, we know who the most vulnerable are, right? We know where where a lot of the comorbidities lie, and that is with people living in poverty, and that is people of color, and people who don't have access to resources. And I mean, people throw around the idea of death cult, but I think it's really, I don't know if that's as accurate as long as the right people are dying, we're okay. I mean, we understand there's going to be a couple of a couple of dolphins caught in our tuna nets, but as long as we're hauling in the big tuna, we're okay with that. And that's been the attitude, really, frankly, of that movement. Going back to whether it's voting rights, following Reconstruction, or really anything.
If it looks like it might be impacting like Tom Hanks and people returning from Austrian ski vacations, then we've got to shut shit down.